In this video, we can discuss about antifungal drugs. These are the drugs which are used to treat the fungal infections. Now we can directly go to the classification of antifungal drugs. It is mainly classified into 5: antibiotics, antimetabolites, azoles, allylamines, and other topical agents. Now coming to the antibiotic, it is again classified into polyenes and heterocyclic furans. Amphotericin, nystatin, hamycin, natamycin are example for polyenes, and Gresiofulvin is an example for heterocyclic benzofurazane. Now antimetabolites, example is fluocytosine. Third group is azoles. It is again classified into imidazole and triazoles. Imidazole is again classified into topical and systemic. Clotrymazole, aconazole, mycoconazole, oxyconazole are example for topical imidazole antifungal agents, and ketoconazole is an example for systemic antifungal agents. Then triazole, which are usually administered as systemic, fluconazole, itraconazole, and voriconazole are example for azole. By reading the name, do not confuse with other azoles which coming under the two group, that is first one is proton pump inhibitors like omeprazole, pantoprazole, lansoprazole, and in antiamoebic drug metronidazole. Do not confuse with that azole. Here azole, antifungal azoles are clotrimazole, aconazole, myconazole, oxyconazole, ketoconazole, fluconazole, itraconazole, and orniconazole. Next one is allylamine, terbinafin, and fifth one is other topical agents like Tolnafate, benzoic acid, quinidochlor, clopyroxylamine, butinafin, and sodium thiosulfate. Now coming to the first drug of polyenes, Amphotericin B. It's an important drug which is used to ask like short note question, pharmacology of Amphotericin B. It's an antibiotic. So majority of the antibiotics are prepared from other microorganisms like fungus by fermentation process. Amphotericin is obtained from Streptomyces nodosus. So that is its origin. Now coming to the mechanism of action, all the polyenes have higher affinity for the ergosterol, which is present in the fungal cell membrane. So this will combine with the ergosterol. That means these polyenes drugs like amphotericin will combine with the ergosterol present in the fungal cell, and which will get inserted into the membrane, and several polyene molecules together orient themselves in such a way that it form an micropore. A micropore on the cell membrane, which will leads to the increasing permeability and which will leads to the leakage of essential intracellular organs like ribosomes, proteins, DNA. So it will leads to the death of fungus. That is the mechanism of action of amphotericin. Now coming to the antifungal spectrum of amphotericin, it have a wide range of activity in yeast, fungi, and different fungus like Candida albicans, Histoplasma capsulatum, Cryptococcus neoformans, etc. Now coming to the ADR of amphotericin B, it have an acute reactions on each infusion, which is consist of chill, fever, aches, pain all over the body, nausea, vomiting, dyspepsia, which usually last for 2 to 5 hours. which is probably due to the release of cytokines, which is an inflammatory mediator released by non-specific immune response of our body. Now, long-term toxicity while using for a long-term amphotericin will cause nephrotoxicity, acetomia, reduced glomerular filtration rate, acidosis, hypokalemia, and inability to concentrate the urine. So these are important ADR which will affect on long-term toxicity. Then CNS toxicity occur on intrathecal injections like headache, vomiting, nerve palsies. Now, what are the uses of amphotericin B? Mainly applied topically for oral, vaginal, and cutaneous candidiasis and otomycosis. Also used in febrile neutropenia, leishmaniasis, intestinal candid, and leishmaniasis. Now we have already mentioned the long-term toxicity, that is nephrotoxicity. So amphotericin B will show an important drug interaction with other nephrotoxic drugs like aminoglycoside, vancomycin, cyclosporin. So if we are administering amphotericin with other nephrotoxic drugs, it will enhance the nephrotoxicity as well as it will lead to renal impairment. So that is all about amphotericin B. Next drug is Gresiofulvin. This is also an antibiotic which is extracted from Penicillium gresiofulvum. Mechanism of action of Gresiofulvin is by interfering with mitosis, also abnormal metaphase configuration. It will inhibit the cell division, so thereby it will inhibit the growth of different fungus. Now, what are the ADR? Headache, GI disturbances, CNS symptoms, peripheral neuritis, rashes, photoallergy. So which have we have in that case we have to want the discontinuation of the amphotericin B in photoallergy cases. Then gynecomastia and transient leukopenia and albuminuria without renal damage. Amphotericin have renal damaging effects, but in case of Gresiofulvin, it will transient leukopenia and albuminuria will cause, but without renal damage. Now, what are the uses? Which is used in tinea captitis, tinea barbae, and tinea pedicis, and otomycosis. Now, important drug interaction. This is Gresiofulvin is an enzyme inducer, so it will induce the metabolism of different drugs like warfarin, which will lead to decreasing the efficacy of that drug like warfarin, which is used as an anticoagulant. Also, it will increases the metabolism of oral contraceptive, so it will lead to the failure or loss of efficacy of oral contraceptive drugs, and also it will produce intolerance towards the alcohol. Now coming to the imidazole, azole drugs of antifungal drugs. All these type of azoles, fluconazole, ketoconazole, or oniconazole, etc., will act by same mechanism, that it will inhibit an enzyme lanosterone 14 demethylase, which is an cytochrome P450 enzyme present in the fungus lanosterol 14 demethylase. So it will inhibit that enzyme, which will leads to the inhibition of ergosterol synthesis. So it will leads to the abnormalities of membrane and leads to the death of fungus. So mechanism of action by inhibiting cytochrome P450 enzyme lanosterone 14 demethylase, which is an essential enzyme for the synthesis of ergosterol. Thereby it will inhibit the ergosterol synthesis and leads to abnormalities of membrane. Now important ADR are gynecomastia and menstrual irregularities. Now coming to the first drug of azoles, clotrimazole, which is available in different forms in market like solutions, cream, ointments and lotions, which is used for different functions, mainly applied topically for the treatment of tinea infections like ringworm and for oropharyngeal candidiasis and for skin infection caused by corynebacteria. So these are the uses of cotrimazole. Now second drug is ketoconazole. Important of ketoconazole is it is the first orally effective broad spectrum antifungal agent, but it have a disadvantage of its absorption will be facilitated by gastric pH. So means it is more soluble at lower pH, that is acidic pH. So if we are changing the acidity of gastric pH to basic pH by using some antacids, the efficacy of fluconazole, absorption of fluconazole will be reduced. So that is the disadvantages of ketoconazole. Now important ADR are nausea, vomiting, which can be reduced by giving the drug with the meals. Now other effects like loss of appetite, headache, paresthesia, rashes and hair loss. The most important drawback is hormonal effects. The ketoconazole will decrease the androgen production from testes and also it will displace the testosterone from protein binding site. Now, what are the uses of ketoconazole, which is effective in dermatophytosis because it is concentrated in stratum corneum and deep mycosis. Used as a lotion or shampoo, it is quite effective in serovia of scalp and dandruff. Then used in dermal leishmaniasis and Kala-Azar. High dose of ketoconazole is used in Cushing syndrome to decrease the corticosteroid production. So these are the uses of ketoconazole. Now next drug is fluconazole. It's also an orally effective azole drug, but it have an advantage over ketoconazole that it will not be affected, its absorption or bioavailability will not be affected by food or gastric pH. So that is the advantage of fluconazole, which have an higher bioavailability, oral bioavailability. 94% is absorbed because it will not depend on the gastric pH as well as food. Now what are the ADR? Nausea, vomiting, abdominal pain, rashes, headache, elevation of hepatitis transaminase have been noted in AIDS patients, and it is not recommended in pregnant and lactating mothers. So that is the ADR of fluconazole. Now what are the uses of fluconazole? Used in vaginal candidiasis, oropharyngeal candidiasis, most of tinea infections, then coccoidal meningitis, cryptococcal meningitis, cutaneous candidiasis, and used as an eye drop in fungal keratitis, systemic and mucosal candidiasis in both normal as well as immunocompromised patients. So these are the important uses of fluconazole. Now coming to allylamine drugs, terbinafin. This is an orally and topically active drug which is active against dermatophytes as well as candida, belong to the new allylamine class of antifungal agents. Mechanism of action, it will inhibit non-competitively of an enzyme that is known as saccharine oxidase, which is an early step enzyme for the synthesis of ergosterol. So thereby by inhibition of saccharine epoxide, it will inhibit the biosynthesis of ergosterol, which will leads to the membrane abnormality and leads to the death of fungus. Also accumulation of sacculins within the fungal cell appear to be the responsible for the fungicidal actions. Now, what are the ADR of terbinafine? Gastric upsets, rashes, taste disturbances, hepatic dysfunctions, hematological disorders, severe cutaneous reactions. These are the important area of terbinafine. Now, it is used in localized tinea pedicis, tinea cruris, tinea corporis, and ongomycosis, tinea captitis, and widespread lesions of different fungus. So these are the uses of terbinafine. And last two drugs are Tolnafate and Quinidaclor, which is used as other topical agents. In this, Tolnafate is used against tinea cruris and tinea corporis, and Quinidaclor by oral route it is used as an luminal amoebicide, and it also have an weak antifungal and antibacterial activity. It is used in dermatophytosis, mycosis barbae, seborrheic dermatitis, and infected eczema, etc. So these are the different uses of quinidocor and tolnafate. So this is all about antifungal agents. In this, three drugs are more important, which are frequently used to ask in pharmacology university examination of second year second year nursing students. So amphotericin B, Gresiofulvin, and any one of azoles, clotrimazole, iconazole, miconazole, oxyconazole, ketoconazole, fluconazole, itraconazole, and vorniconazole. So do not confuse with other azoles. That is all about antifungal agent. So thank you for watching this video.